Today 3D printing has a potential in every aspect of manufacturing, and this is a unique initiative and which I feel would help each and every seeker in this domain to further his interest and grow the technology.
It is going to bring about a revolution. You can think that a world without a disease, without disability.
Today I can say that whatever that you can imagine can be actually put into practice with the medium of a software to print or give substance to your ideas with the help of 3D technology.
It's been our conscious effort in terms of want to communicate and create the awareness.
Better, and it's easy for people to access it and make interesting products out and take their imaginations into reality.
This is a platform where we can promote these technologies.
For a simple reason, because 3D printing is a technology which is going to change the way things are.
Ladies and gentlemen, a very warm good evening. As usual, we do have an opportunity to interview respondents across industries and also experts who have been doing some great work in the areas of 3D technology and also some technology companies offering solutions and also end users using the technology. For those of you who probably would have known about 3D Graphy lately, 3D Graphy is a consortium. We've been in the space for last 8 years, and our core area of exercise was always into media in terms of promoting 3D technology in the country across different sectors, from aerospace, defense, automotive, heavy industries, medical, dental, bioprinting, tissue engineering, art, education, all of that. So it's a huge gamut that we are actually in today, where this technology is definitely helping industries and respondents using this technology. But 3D technology also, ladies and gentlemen, constitutes of 3D printing, 3D visualization, AR and VR is also gaining a lot of traction. Also 3D simulation and software, and also material science, very important, because that's the time that we are actually today in, wherein new materials are actually getting evolved and scientists and researchers are looking at these solutions. And we as a company have decided that now that we are very actively into events and conferences, our conscious effort is also to see that how it can be an information source on an ongoing basis, so that we reach out to technology companies as well as solution providers and also end users to have also come with their interest in terms of knowing what and how these technologies can help their area of specialization. So 3D Graphy news, a conscious effort for us to connect cords with everybody from 3D technology companies to end users to researchers and scientists, designers, and everybody to learn and be updated of this technology. So today it's a great time for us to have an opportunity to interview one of the key respondents and also a surgeon who have been offering his service for head and neck, Dr. Girish Rao, who is a maxillofacial surgeon and also the honorary secretary for AOMSI, which is actually an association in oral maxillofacial surgery. and they've been actively involved for almost 20-25 years in the space, or even more, for what I know. Sir, good evening to you, sir, and thanks for your time. It's a privilege to have an interview with you. Doctor, just wanted to understand from you, what was your understanding of 3D technology? When I say 3D technology, now that encompasses of 3D printing as well as 3D visualization and simulation all put together. But I think much of that will be also that we will develop on 3D printing. But yeah, largely about 3D technology, sir. Your inputs and your experience and where it all started and what was your first interaction?
Good. Good evening, everyone, and thank you, Dr. Shibu John, for inviting me for this wonderful session where we share knowledge and we grow from each other. It's been a pleasure for me to come and have a chat with you today. I've been in maxillofacial surgery for about 32 years, and I had my training. I did my initial training in India, did my post-graduation in Chennai, having done my graduation from Bangalore. From a dental background, I moved into maxillofacial surgery, and then I spent almost a decade in the 90s in the UK. And UK was an eye-opener for us. I mean, in the 90s, when we were training, at that point of time, surgery, at least maxillofacial surgery, was in a very, very infant stage, I would say in India. We had to go out to learn newer technology. And, our jaws would drop when we see the kind of aesthetic work, the kind of oncology which was being done in UK. At that point of time, I was introduced into microvascular surgery, where having resected the jaws, we were reconstructing using either a hip bone with its, artery and vein, or the leg bone, which its artery and vein, or the most common radial forearm flap, or the anterior lateral thigh flap. So this was a revolution, I would say, in terms of reconstruction for the oro-facial region. And I had a boss in Torbay Hospital. This is in southwest UK, Torquay. It's called as the English Riviera. And this man, Hugh Walters, was very, very tech savvy, I would say. An elderly gentleman, a classic, old-styled Britisher, but he was over-enthusiastic on computers and on building programs, and that's when he introduced me into the novel computer-based planning. So that is where, and he would, do his own design, and he would write his own software, and that's when I saw that what we were actually doing at an operation table, we could actually do the entire orthognathic planning. That is basically the jaw surgery planning. I got introduced very early in my life on that, and we had to do all the planning on the computer. So we would do the simulations at that point of time. And then we had a 3D printer. So we would actually do the models. So the models of the maxilla and the mandibles, and what we used to do, the model surgery, was my initial exposure to this new and novel technology of 3D printing technology. So from there, having come back to India, having trained further on in London at the Royal London Hospital, where my bosses were very, very, very good at it. They were probably the best in the UK. Ian Hutchison and John Carter and Kieran Coughlin. These were my consultants who were really wanted to bring in technology into the maxillofacial and surgical facial cosmetic work. So when I came back to India and set up my own unit in Bangalore, obviously even I had that background which I wanted to very quickly adapt into the Indian circumstances. So I started working with a lot of companies in Bangalore, and in the initial phases we would do the planning and get the model surgeries. It was just stereotactic models on which we would get. So that used to give us a lot of information. But then when we were introduced to titanium, which could be printed, I think probably about 4 or 5 years back, we used to, in fact, I had a patient, one of my first patients, who came all the way from Assam. He had a jaw tumor. This was an ameloblastoma. It's quite a common jaw tumor. And classically, I've done probably more than 400 reconstructions using fibula in our unit. But this guy was a sports person. He would play football, and he said, is there any way you can spare my leg? Don't take the bone. So that's when we started looking out, and it was a need. And we found out that in Israel and in Singapore, they were able to get us the printed titanium. So that's my first case, which I did about 5 years back. So we had to wait for almost about 2.5 months. Having sent it, there was a queuing system, and but luckily we were able to get it, and we did the first 3D printed mandibular reconstruction in Bangalore almost around 2015, 2016 during that time. And after that, I never looked back. Then I'm very lucky that we have companies now in India which suddenly mushroomed all over in the last 2 or 3 years, and they're giving him quality of work which was coming from Germany, from Israel, or from Singapore. So I'm really delighted and excited that we are able to do this kind of work in India now.
Very true, Doctor. I mean, this is actually taken by time from where it all started. I also know for the fact that when we started introducing the technology 8 years back, we did have respondents in the country, offering these solutions. But now I think we are at a time when democratization of 3D technology in the medical is going to be a game changer, sir. I mean, I think it's very rightly that you said. And I'm sure the exposure that you have got already, and now to see that it gets instituted in the country itself, ensuring that the time span that it would take for a surgery would be much faster. Execution also can be faster. Doctor, now that you understood that the prospect is there, as an association, sir, also being at the helm of the association in terms of taking from here on, as we progress, what would be your immediate plan to see that this technology gets democratized in the country, and how it can benefit all the maxillofacial surgeons going forward?
To be honest, I feel this technology, I'm super excited in using this technology, because this is a game changer. Just for the fact that, it makes our surgery so much easier. It makes it so much predictable, and the outcome can be fantastic. I mean, I remember whenever we were doing all the, the bony cuts in the leg, to, a straight bone, we had to shape it into a horseshoe shape of the jaw. It used to really take a lot of expertise, and, the training which we had, luckily, gave us that kind of head start, I would say, 30 years of training. But when I now see the kind of, what you can do on the computer, I think a young maxillofacial surgeon who's just, been trained for about 3 to 5 years can very easily adapt this technology and give probably better results than what we were giving, in terms of outcome. The shape can be precise, the contour can be fantastic, and the surgery can be done at probably 1/4 of the time than what we used to take. So, you are putting your patients at very, very less risk. So I think this is probably the biggest motivating kind of thing for us to really adapt this technology. As the Secretary, Honorary General Secretary of the Association of Oral and Maxillofacial Surgeons of India, we are a group of almost 8,000 maxillofacial surgeons across the country. This is the entire length and breadth of the country. And we have been very, very keen to adapt technology. A lot of maxillofacial surgeons, really want to take up what's actually being done anywhere in the world. And that's why we try to get people from across the globe, from ever since we were trainees. We would always be inspired by people who would come from UK or from US. And wow, we would just, see the kind of thing. And today, our association is training youngsters. We are taking this, of doing fellowship programs, where after they finish their training, their 3 years of, post-graduation training, we have identified centers of excellence where we actually get them to basically learn a specific skill. It could be a cleft lip and palate, it could be oral oncology, it could be aesthetic facial surgery, or it could be trauma surgery. And that's where we want to introduce even 3D printed technology today, so that youngsters can actually learn the entire science of it. It's not just that, oh, you send it to the lab. From planning stage to executing is what you need to train them. So it needs to be a complete package. And that's what we want to introduce, a complete fellowship program, which is going to be for a year or a year and a half, hands-on kind of training program, where we want to bring in the industry, the university, and the clinicians together, and the research organizations together, all of them together. And when you bring in this kind of teamwork, that is where you're going to get the best results for your patients. And that's what we want to really introduce from our Maxillofacial Society.
Doctor, very true. I mean, that's the way forward. I mean, there has to be a collective effort of experts when it comes to research and material science, and clinician and policymakers. Definitely, they would definitely get the pathway set for us. But I think constructively, here is something that, since you've already initiated in terms of this fellowship program, would be a game changer. Doctor, there is also something that we also see that in our past experience, because 3D Graphy also works as a consortium, wherein we have surgeons, designers, material scientists, all of them put together. We've seen that there is new advent and new development in material science. So we are looking at a time when you have a choice to make between a bone-like material and a titanium, especially when you have cases of malignant cancers. I think this becomes a better option for doctors to choose. What do you think? How is that evolving? And any thoughts on that in terms of where we could also be of a help in terms of working together in confluence to that extent? Because we have a lot of researchers working on various different materials, Doctor. Your thoughts, sir?
Absolutely. I mean, there are two areas where we are really working on this technology. One is the hard tissue and the other is the soft tissue, right? And when we're talking about hard tissue, replacement of bone, I think metals have really done extraordinarily well, right? We have had, titanium peak and things like that, which we can, we have, made it almost like a standard kind of protocol on which we are doing. But still, when we want to get function in, you can get the form very well. You want to put teeth in, we'll have to put in implants and things like that. So on titanium, unless you have struts which are coming out on which you can put crowns in, that's okay. But then the biggest problem what we face is the fact that when it's in the oral cavity, there is a possibility of a breach of the soft tissue, and then you have the infection which can set in, and many a times we have to remove this prosthesis off completely. So I think the way forward should be to get in resorbable scaffolds, which we can print, and we should be able to basically go in and, you grow your cells outside. It could be osteoblasts, or, you have so many kind of things which you can put in there, and these stem cells and things like that, which can differentiate into bone, and the scaffold should resorb, and you have a complete bone. The jaw is completely constructed using this kind of mesh or a scaffold in which we have injected these cells which are cultured outside. So that probably is the way forward, is what I would like to look at. Similarly, soft tissue. This is a challenge. I mean, growing skin, growing muscle, growing gingiva, all these kind of structures, that's the mucosal lining inside the mouth, is always a challenge. And that's where I think we need to start working on, again, scaffolds into which we can put these cells in. So you get the epithelium, you get the mucosa, you get the muscle bulk in, and that's something which is going to be a complete different level of game changer, I would say. So I wish a lot more scientists who can grow these kind of things and integrate them together. It's a layered kind of thing. You need to have the skin outside, you need to have the bone and the muscle in between, and then you have the lining, that's the mucosa inside. So if you're able to get all these things adhesive together and grown outside, tissue engineering is something which is going to be completely beautifully done. And if you can get printers in to do these kind of things, it'll be fantastic. And people are working towards that. Unfortunately, what had happened, at least in India, was people were working in isolation. Clinicians would be working in the hospitals and their own practices. The lab, there are fantastic researchers. I mean, in ISC, IITs, and we have the material science labs. There they were doing some really, really good work, and there were professors in the university, teaching these kind of things. That marriage never happened in India. When I go to Japan, when I go to Germany, when I go into the US, everybody is talking to each other, and I'm glad that we are through forums like this we are interacting. And then we have got the industry coming in, who is not only bringing the products but also funding youngsters to train. You see, that's very, very important. It has to be a win-win situation for all of us, so that collectively the entire profession grows.
So, Doctor, we also did a very little thing. I mean, that we could do is to have built this consortium. Very recently, there were some young minds who have come up with resorbable and biodegradable materials with hydroxyapatite in terms of looking at that as an option, and also have created their own IP, and we're looking at that option. So we did help them to connect with the right source, maybe from from the industry, from the maxillofacial space, where doctors also who are entrepreneurs who have taken that as an opportunity, working in conference together. You're right, sir. I think a cohesive effort of working in confluence together to achieve the larger goal is very, very important. And I'm sure the association is also doing its bit. Also, what is the extent of value creation that you would probably want to do, sir, as an association in the country, on those lines, if there is any that you could actually share? So, wherein we can also try and build a pathway working together in conference.
I mean, actually, in the last 2 years, the whole country has been ravaged with coronavirus. The COVID pandemic has completely destroyed so many lives. But during the second wave, we had, we call this as an endemic within the pandemic. We had the black fungus or the mucormycosis, which very badly affected people's faces, right? In fact, the jaws were removed, both the upper jaw, the lower jaw, the eye has to be removed just to basically save patients' lives. Otherwise, the fungus could have gone into the brain and that could have had a fatal outcome. So there are, I think, probably more than about 20,000 patients across the country who have been ravaged and crippled on their faces because of this mucormycosis or black fungus endemic, which happened during the pandemic. So as our association, the Association of Oral and Maxillofacial Surgeons of India, we have taken this on a war footing, and we have started identifying who are these kind of people who needs this kind of rehabilitation. We have volunteered to do completely free for these kind of patients. We're raising funds so that we can actually print these kind of prostheses, whether it's on titanium or PEEK. So we are going out to a lot of philanthropists. We are asking for CSR funds to come in to help our association. So we've created that. And our prosthodontic colleagues too, they have come forward. So we're working together. So they are also pitching in their kind of rehabilitation for teeth. So we are doing on the facial reconstruction and rehabilitation, and they will give the teeth on top of that. So as both these associations working together, I think we can make a huge difference. And that's something which we have taken on top priority. And we would really, really like to help all these patients. Very unfortunately, they have been crippled from their, facial disfigurements. They cannot speak, they cannot swallow. And, both function and aesthetics has been very, very badly damaged. And that has a huge implication on the psyche of an individual. We have had youngsters, in their, early teens to very elderly people in their 80s whose face has been mutilated because of this black fungus. So the AOMSI is very keen to help all these patients, and that we are going to start in a very big way. We've already started the process. We have rehabilitated quite a few, but I think we would like to scale it up and go to about 20,000 patients, which we would like to do in the next couple of years and help these unfortunate patients. And that's where I want the industry also to help us so that we can start off with this and then move into other areas in terms of reconstruction and rehabilitation.
Doctor, very rightly so, sir. I mean, everything also needs to be taken into consideration when it comes to charity. It all
Absolutely.
needs to start from your own home to begin. So I think a great effort that you have been doing, Doctor. I mean, I know for the fact that some people that I knew who had also done a lot of work, helping the community, doctors and surgeons like you, who come with that kind of a helping hand in terms of supporting, people who had no option but then to look at somebody to come and help them in terms of ensuring that the face, more than the facial aesthetics. It was more like life-saving life-saving technology with 3D technology that we've seen that it has really helped many of the respondents. Doctor, now that you know that this technology can gain a lot of traction and it can also help the end user, we also believe that patient satisfactory index is actually a norm that needs to be set as a pattern in the country. And I'm sure a lot of organizations and institutions and hospitals or the doctors are following it. But if we are seeing a possibility of a point of care kind of a setup, it becomes even more convenient for a patient to also see the virtual planning and also through the models to exercise and to be assured that this is the way that they're going to be treated, because that's something that it's a right to to the end user. What do you think about this point of care as a concept, sir, with the technology getting that kind of attraction in the country?
I think this is a brilliant idea. I think we need to, as I said, identify centers of excellence and bring in everything into that center. See, the thing what happens is we have seen when more numbers are done, you learn very fast because the numbers basically teach you itself. You see more complications and then you can evolve very quickly. You can make some course corrections and then you can actually get it right. So it's still in the nascent phase of the kind of cases which we are all doing across the globe. We are talking about. In fact, India probably we have less regulations, so we have actually taken it up in a very big way compared to a lot of other countries, I would say. Although we are very, very careful, we do have our ethical committees and things like that, which oversee all these things and approve for any clinical trial before we do that. But still, I think in a country like India, we can adapt the technology very quickly into the medical profession, and the numbers are huge here. So that is something which is going to give us a huge learning experience too. I think if we can have probably about, a country like India have about 10 or 20 point care kind of centers across different regions, or in each state we have, that could be a point of reference which we can have, and we can have that partnership between government and private bodies. It could be a win-win situation for everybody, and I think we can give some brilliant results with this kind of setups. So I do believe that's the need of the hour, and that's where we all need to come together and bring in that technology so that the patients will ultimately benefit with this.
Doctor, one more thing that we all know about AI. So we also are at a time when now, as you rightly said, a center of excellence where there's a lot of immense data that can be collected. Then the analytics way in terms of routing it through the right way in terms of making the diagnosis and making a final call in terms of the surgery is definitely going to assist and help. What do you think about the 4.0 as a technology with AI and 3D printing all coming as in the surface of making planning efficiently executed in the course? So what do you think about that, sir? Just your thought.
Absolutely. I think it's going to make life so much easier. I mean, you have the data to back you and then say and validate that, hey, this is so good. So I think AI is going to actually come into every walk of our life, and the way in which it has already completely stormed us in different ways. I think even into 3D printed technology and into our surgical practice, we are going to adapt this very, very quickly. There is going to be a lot of accountability because of that. And I think once you start putting data in and start analyzing this, there are going to be predictions which are going to come in. It's going to start saying, hey, instead of doing it this way, we are going to have a better outcome by doing it in this kind of newer way. So I think we are going to adapt this very, very quickly. So it's going to be a completely new game changer for all of us. And people who adapt these technologies are the ones who are going to leap forward, and their outcomes are going to be much, much better. And today, at the drop of the hat, patients know what you're doing. Your reviews are basically, they come to a practice having seen your reviews. So the word starts spreading very fast that this center is doing such wonderful job and they have done so much of excellent work. So we have to bring it to our patients and make it into an open source kind of thing so that they can start seeing things and start coming into our centers. So as long as we do it properly and ethically, and our associations actually start monitoring that, because we don't want false reviews and things like that. You see, that's another thing. So if we can do multi-centric clinical trials to start off with, and with these kind of point of care centers, probably we could be the world leaders in the next couple of years. The greatest happiness comes to me. We had to go to UK or US to learn, and I think we are at that ripe time where people from all over the world should start coming to India, and we should actually start teaching them. This is our experience. Exactly. This is how our outcomes are, and this is which is going to be a game changer for them. So we need to adapt these kind of things. We need to start publishing a lot of these data, and people will start noticing us at that point of time, and they will start coming to India, not only to undergo treatment, but also to start training. That's something which we can actually make a difference.
Very true, doctor. And making it more cohesive now with this, with 3D technology and various other technologies like AI, as I mentioned, things are becoming more simplified. And where doctors have also taken that interest on also writing research papers, doctor. Now Absolutely. We have also aspirants, PGs, who are also looking at coming up with research papers, writing their research papers, want to be excited about the profession that they are in, to come up with various new solutions. So I think we are at a very exciting time.
Absolutely. Just to digress from there, I was introduced to virtual reality and augmented reality and to haptics, and the planning from that kind of perspective. We started through our what's called as the Global Dental Academy, which is a small startup from our side. Initially I was a bit hesitant to see whether people are going to start using it. But now for training, I feel virtual reality is something which is really, really a huge game changer. So I think technology is there for us to basically use. And that's where we need to really, India is at the right time, as our Prime Minister says. We need to really jump in and make in India is something which we would all love to do it. All these years we were looking at the West. Now I think we need to look into ourselves and start teaching the whole world that we are also, in par or probably even better than them.
No, the intellects and the intellectual, practices that we've seen with experience, there are some great minds and great people who have really been good at in terms of managing things right, even indigenously in the country. And also to let you know, sir, now that I think if the national strategy for additive manufacturing is also set by the Ministry of Information and Electronics. I think the pathway is also set for a great prospective development in terms of research and development being at the pinnacle for companies to also come up with indigenous machines, to also democratize the scope of making these machines more cheaper. So I think we're at a right time, and obviously everybody constituting to the effort in terms of the right way going forward, and also everybody aware about that particular situation. Thank you so much, doctor, for your time. It's been a really good to have you on for this particular conversation. And also your pragmatic and your visionary thoughts in terms of what it can lead to. And I'm sure the young aspirants would definitely take this as a point of aspiration going forward as an association. And thank you so much for the efforts being made, especially for the efforts that you've been doing in these recent times with people suffering from the mycomucosis, in terms of, and you did mention that there has also been a conscious effort supporting that set of people in the community. Great effort, sir, and thank you so much for your time, and thank you for your presence, sir. Thank you once again.
Thank you, Dr. Shibu. It's a pleasure. From the Association of the Maxillofacial Surgeons of India, it's been an immense pleasure to be a part of 3D Graphy, and I'm really looking forward for collaborations with different organizations, with different specialities, with the industry, and with the universities of different, states, private universities as well as government bodies. I think if we can all work together, we can make a huge difference, and let clinicians and the industry and researchers come together. And I think we can make India great again. Thank you so much.
Thank you so much, sir. Thank
It's
you,
been
sir.
a pleasure to be with you.
Same here, sir. Thank you.
Thank you.
Thank you,
Bye-bye.
sir. Thank you.